Let's do vitamin B12 deficiency. Lack of vitamin B12 or folate that causes the body to produce abnormally large red blood cell and that cannot function properly. So vitamin B12 deficiency. So, patient can have vitamin B12 and folate deficiency as well. You need to be very careful how you're going to treat it. Are you going to treat vitamin B12 deficiency or folate deficiency first? Let me know. So presenting complaint could be tiredness. What else we need to look for? We need to ask for the signs, symptoms of anemia because it's a vitamin B12 deficiency. It's anemia. So tiredness, dizziness, shortness of breath. But vitamin B12 deficiency can cause pins and needle sensation as well, right? So numbness, pins and needle sensation in the legs, vision disturbance, mouth ulcers, vitamin B12 deficiency. So these are the things that you can ask as a part of your data gathering, right? So tiredness. What I'm going to look for, cancer. I'm going to hope for the best, but I'm going to think for the worst for my patient, right? So cancer question you can ask, depression because tiredness, so you can ask for depression questions as well. And you can rule out iron deficiency anemia as well. But that obviously, when you do the investigation, you'll be able to figure it out if it is going towards iron deficiency or vitamin B12, because your MCV is going to be low in IDA in iron deficiency and high it's going to be high in vitamin B12 deficiency. What is the reason why you get vitamin B12? So it could be dietary related, it could be non-dietary as well. But vegan diet, that is one of the most important reason when you are on vegan diet, because it's a trend in all the countries, I would say nowadays, but it is more in Western countries to opt for vegan diet. So that is something you have to check out in the history itself. Smoking, alcohol, starvation, when you're not eating, obviously you can have anemia, isn't it? So that is the thing. Psychosocial history always you can take, because when you are having vitamin B12 deficiency, you feel irritated. You feel lack of concentration as well. Some of the symptoms you can't even explain. Those are the symptoms that you will get in vitamin B12 deficiency. So yeah, psychosocial history is going to be very, very important here. So general physical examination, vitals, cardiovascular, abdominal examination, that's what you can do. So full blood count, you have to do peripheral smear, you can do vitamin B12, you can check folate levels, you can check iron to make sure you are ruling it out. I mean, iron deficiency anemia, you are ruling it out, right? So these are the things. If it's anemia, you can do celiac screening as well. So these are the things that you can mention here. Now it comes to the treatment. So you have to treat it. Yeah. So symptomatic treatment, that is what you have to do. So make sure you treat vitamin B12 before folate deficiency, right? So B obviously comes first, then F. So you treat vitamin B12 first. And then you can review the patient after a few weeks and see if the patient is improving or not. Yeah. Now, if patient is opting for vegan diet, you cannot force the patient to go for normal diet. That is fine. I mean, but you can suggest something. They can eat something which is fortified with vitamin B12. Right. So that is there, like a lot of things that you will be able to find in the market, like the food is actually fortified with vitamin B12. So that could be really, really important. Now, what is going to be the treatment? Vitamin B12 deficiencies, obviously you have to give vitamin B12 there, right? Now, the thing is, if it is dietary related or if it is non-dietary related. If it is dietary related, so what you have to go with first, it doesn't matter if it is diet or non-diet related, you have to give injections of vitamin B12 for 2 weeks, alternate days. And if it is diet related, so we tell the patient to take vitamin B12 tablets daily or injection maybe every 6 months they can take. But if it is non-dietary related, then injection every 3 months. That is what they can take. Right. Again, I know it might be a bit difficult for us to remember how many injection, when to take tablets, and all this is fine. You can tell the patient, I mean, first we're going to give you the injections for 2 weeks and then later followed by the tablets in case of diet related and injection every 3 months in non-diet related. So make it a bit simple for this patient. Vitamin B12 deficiency, what are the warning signs that you can give? You can give the neurological symptoms. fainting, neurological symptoms, pin needles in the limbs and all, that could be your warning signs. And definitely you have to mention about the follow-up as well. Usually tell the patient to come for the follow-up in 4 or 5 weeks time. So that is going to be really, really important, right? So ICE, very important. Chuck and check, give the information, bits and pieces, summarize, acknowledge, body language, signposting, active listening, leaflets. All these are very important. How long it's going to take to get better? I mean, if it is patient is asking you these questions, how long it's going to take, so you can mention how long it's going to take. I mean, the treatment, if it is, I mean, they're not taking in the diets, of course it's a long treatment, but when you give the injections to the patient for 2 weeks, alternate days, patient will feel better with the symptoms and all. Is it serious? It's manageable condition, and we can definitely control it. We can definitely manage your case. All right.